Hi, I'm Dr. Joubin Gabbay. I'm a board-certified plastic surgeon in Beverly Hills, California. In our videos here, you usually see me talk about all of the different aspects of my cosmetic surgery practice, but there's one little side you may not know too much about. I help cover big plastic surgery emergencies at one of our major hospitals here in LA, which obviously I can't tell you the name of, but it's an interesting side of my practice that is just right for Halloween. I've got 4 stories from the emergency room that will make any Halloween horror movie pale in comparison. Let's talk about it. Guys, these are some incredible stories with incredible images. But you need to know some of these images are real. No, not some. All of these images are really, really graphic. It's gonna be shocking. If you don't think you can stomach it, don't watch. I've got a bunch of other great videos. You can check those out instead. This story I want to tell you about is of a slashing victim. Now I say slashing in opposition to stabbing, because you usually hear a stabbing victim, it's like this, they're punctured. She didn't have that. This is a poor woman whose son-in-law attacked her and literally slashed her top to bottom from her mouth to her chest, leaving her with these big gaping slash marks that we had to deal with. I was finishing up at the office one day and got a call from the emergency room at the hospital. The people who called, you could see, were a little shaken. Something about an elderly woman who was involved in a knife fight and had some crazy facial lacerations. They really didn't want to give me details. They just wanted me to get over there. I obviously did, ran in the car. My office is just 2 minutes away from the hospital. And I understood why when I got there. Now I'm smiling because this was a story that was truly tragic, but ended up really the best it possibly could. And we'll talk about that. I walked in there and I saw that she, sure enough, had an incredible laceration along her entire face, into her mouth, along to the other side of the face. She was slashed all the way through. When she opened her mouth, you'll see in the pictures, there was a cut from this cheek, under her tongue, straight to the other cheek. Now it was a little nerve-wracking because she was bleeding pretty copiously from her tongue laceration. So quickly went to work. Interestingly, a good amount of local anesthetic squeezes down the blood vessels and quickly controlled her bleeding. That got things to calm down a little bit, which is the most important thing when you're dealing with an emergency like this. So when I got to the emergency room and everything calmed down, I was able to speak with the patient. And interesting, her cheeks were open, her tongue was cut, but we were absolutely able to speak together. And from her and her children, I got the story that little bit of an altercation with her son-in-law. He got angry, he started slashing her, and at the time, he was on the lam. They didn't even know where he was. The police were chasing after him. I explained to her what my plan was with the operation, and really the most simple way of explaining it was, everything was there, it was just cut open. We were going to put everything back exactly where it belonged. There are nerves there that control the muscles of the face. There are the muscles of the face. There are ducts that carry your spit into your mouth. There are a lot of blood vessels. There are all the things that help us be human. Help you chew, help you eat, help you talk, help you swallow. And if you don't do things right, they're not gonna work properly. So the operation went beautifully. Her recovery went beautifully. She was in the hospital for a couple days. She went to my office regularly for the next couple of weeks. We worked with her on what to eat, how to get her speech back, how to recover everything so the scars were perfect. Then she came back to my office a couple of months later and I was blown away. Her scars were virtually invisible. She was talking perfectly, eating beautifully, happy. And her son-in-law turned himself into the police and they got all that squared away. This story is an interesting one about a gentleman who came in from Boston to LA for a little business trip. had some friends in town, he went out with them. Next thing he knew, he woke up in the middle of West Hollywood somewhere in the morning with his face just open, bleeding, and he had absolutely no idea what happened, how he got there, or what to do. So I popped into the emergency room to check on this guy, and sure enough, he was sitting there happy as a clam in the emergency room bay with a nice little piece of gauze over his right eye. We had a delightful conversation about what happened, and the answer was pretty much he had absolutely no idea. I took the gauze off of his face, and there was a laceration here, there was a laceration here, and there were a bunch of abrasions over the skin on his face. But then I started looking in, and this guy's cheek was completely peeled off of his skull. Muscles were there. I was looking at bone down pretty much almost onto his teeth. In my experience, something like that, it looks to me, quite frankly, like he just ate it. He face planted and had all that stuff torn apart. What caused him to face plant? I'm not gonna venture a guess. It was an impressive injury, but it was something that he and I talked about, and together we decided we were gonna take care of it right then and there in the emergency room. I hiked his whole cheek back up to the bone. I put the eyelid back together first very delicately, but also I had to do very specific things to support the structure of the eyelid. We did that. I sent him home. He literally went back to Boston 3 days later. He sent me messages telling me he was doing well. He actually saw an oculoplastic surgeon over the course of his recovery. They didn't have to do anything. The next thing I knew, this guy showed up at my office 6 months later, and it was unbelievable. You couldn't tell anything happened to him. My staff didn't believe him that he was the guy they saw pictures of and heard stories about when he came in. What was great was that this experience actually changed him, set him on a very, very different lifestyle path. He became healthier, he became happier, he took care of himself. So the next story is about a guy who, funny enough, worked for a skateboard helmet company. He was filming a commercial of him skating down the Hollywood Hills, longboard skating like 50 miles an hour. And he ate it. And he ate it bad. And guess what? Even though he worked for a helmet company, cracked his skull. So I was having dinner with my family and was called by the emergency room for this guy. Came in and checked him out, and it turned out he had actually a big fracture of the bone of his brow. So I went to explore this thing locally in the emergency room to see the extent of what was going on, and I'll tell you, I will never forget. It was crazy, the sound of this crunch of his bones as I was exploring the wound. So obviously we had already started the wheels to get him taken care of in the operating room, because this is something that we knew would need a very, very careful reconstruction in a delicate, controlled environment that the operating room gave us. What was crazy about this was, you have to remember, this guy was filming a commercial for a skateboard helmet company. Well, they didn't stop filming when he just crashed. They were filming us in the emergency room as I was talking to him, as I was exploring the wound. It was such a fun environment because everyone was okay with what was going on. It honestly made it a good and comfortable situation, which I think actually led to his great result. This bone that was broken here was literally like an eggshell that was cracked into a ton of pieces. And what I did was quite literally put Humpty back together again. I put the little pieces of the broken bone together. I screwed them together with tiny, tiny little metal plates and screws. And I recreated the beautiful ridge, the bar of his brow. And at the end, it looked like nothing ever happened. Sewed up the laceration. I put all the muscles underneath back together properly. That was it. Stayed in the hospital for a day. Followed up with me in my office for, a couple of visits. And next thing I knew, he was gone. They made this incredible video and I didn't hear about anything from him for another 6-7 months until you see this happens in my office all the time. The guy came back and It was amazing. These lacerations, you'll just start to see they heal perfectly. You couldn't tell what happened. He was happy as a clam. He was starting another job, and he was still skating like crazy. So the last story is one that really has affected me personally. It's a story of a young woman who was out at a club one night. She was getting ready to go home. She was literally walking into her Uber when her friend said, no, you gotta come with me. I have my car, I'm gonna take you home. But the problem is her friend was drunk and unfortunately got in a horrible car accident. Now, how bad was it? That accident was bad enough that my patient ended up having her face literally peeled off of her skull, among a bunch of other really bad injuries. This was on a Saturday night. I was actually just finishing up in the ER. It was probably about midnight or so, and I happened to be walking by the trauma bay just as this patient was being wheeled in there. You know, I always wait around and see if there's something that I might be needed for, and sure enough, I saw there was a lot of commotion around her. There was a lot of commotion around her head. I peeked in and saw that there was just a massive amount of blood coming out from the top of her head. You're gonna see in some of our videos, she had a huge laceration all across her forehead, and it was bleeding like crazy, and it was very clear that, again, literally her face had been peeled off of her skull. So I jumped in, and of course, the first thing I did was try to control the bleeding. It started with actually putting in a good amount of numbing medicine, because the numbing medicine has epinephrine or adrenaline in it, which squeezes down the small blood vessels in the body and prevents bleeding. It's something we use in surgery all the time, and it was the one thing that helped get her very chaotic situation under control. Fortunately, I was able to close everything after probably what seemed like about an hour, hour and a half of work, and she was then rushed straight to the operating room to take care of an intestinal injury that needed emergency surgery. She was in the hospital for a good long time. I mean, she had a spine injury, she had the stomach injuries, she had all sorts of things going on, but the recovery from my portion of the operation was relatively straightforward. I saw her on a regular basis over the next several weeks and months. We did a lot, obviously, to work on giving her the best possible scar after an injury like this. Little by little by little, things got better. The scar started out quite red, quite firm, quite robust, but with time, with care, it calmed down. When I saw her actually at her 1 year follow-up, it was a very emotional moment for everyone concerned. Her face looked back together again. The scar was literally almost invisible. I mean, it was one of the most incredible things I have seen. What was really great was that she was finally getting back on with her life. She was going back to school. She was starting to work. She was becoming whole once again, but it took a year. In a lot of ways, it took a lot more. This is something that was caused by the stupidity, the audacity of someone who said that you have to come with me and didn't care that they were drunk. This is just one of those unfortunate tragedies that could have completely been avoided if there was no drinking and driving. Simplest thing I can tell you. There are so many opportunities out there now for someone else to drive you home, someone who's sober, someone who's safe. That's all that needs to be said. She should have done it. It would have avoided this whole thing. I hope you enjoyed these videos. If you did, please feel free, like and subscribe down below. Tell me what you think about these. Do you want more of these videos? Because I've got a ton more to share with you. Let me know in the comments down below. Until then, I'll see you next time.